there are a variety of reasons why people are not getting enough quality sleep. Sometimes they're getting enough hours, but it's not quality. That can be due to things as simple as poor sleep hygiene, not, eating late in the evening before going right to bed, and that's going to affect your ability to get deep sleep. Having alcohol, having a glass of wine in the evening will definitely affect the quality of your sleep. Wine, any alcohol in general, are going to lower your serotonin and your melatonin levels. So even if you're trying to get enough hours in, those first couple of hours are not going to be quality sleep. Sometimes it's as simple as having too much light in the room. If unless the room is really dark, a lot of people just don't secrete much melatonin, so they don't get a quality night's sleep. Simple things like that can make a huge difference. Exercise. Some people will decide, they're so busy that the time that they choose to work out is after dinner. And so they're eating dinner and then they're going to the gym and then they're going to bed. It's just like you just worked out. Your adrenaline level is going to be high, your cortisol level is going to be high. How's it going to impact the quality of your sleep? You may be so exhausted that you fall asleep, but you're not going to get the same deep sleep and REM sleep that you need for your body and your mind to heal. There can be other reasons too, hormonal issues. A lot of women, definitely in menopause, but even before menopause, will have an imbalance between estrogen and progesterone. Estrogen is stimulating, and it's why women are smarter than men. Progesterone is very calming, and it really helps women get a quality night's sleep and feel less anxious and other things, help them not gain weight. The problem is that definitely in menopause, but even before menopause, women will start having menstrual cycles where they don't have an egg developing in the follicle. It's the cells of the follicle after the egg is released that produce progesterone. If you happen to have a cycle where there's no egg, which does happen with increasing frequency as women proceed through the years, then the body's smart enough to go, well, if there's no egg, there's no point in making progesterone. So in that cycle, the women have estrogen, but they have no progesterone. And so as a result of the low progesterone, they have an imbalance between estrogen and progesterone, and that can lead to insomnia. For many people, the doctor will just give them a sleeping pill. It's like, okay, well, but how is that helping? You are unconscious, but are you having the slow wave, the deep sleep, and or the REM sleep? Typically, with most medications, you're just unconscious and you're not getting that quality healing sleep. A lot of women will complain about insomnia, maybe a little anxiety, again, due to this hormonal imbalance. And the doctors will either give them a sleeping pill or they'll give them an antidepressant. And what they really need is some progesterone. They need to have their hormones balanced. So that's where I go. I say, well, let's get to the root cause. Is it a hormonal imbalance? Is it your sleep hygiene? Are you sleeping with the lights on? Are you sleeping, are you working out in the evening? What are you doing that's interrupting your natural tendency to fall asleep and get a good night's sleep? Because that's our nature, is to sleep. But because of our lifestyles have become so dysfunctional, if you will, a lot of people don't typically get it. So again, the bottom line is we want to get to the bottom, the root cause of why they're not getting the quality sleep, and address that, as opposed to taking the medication, which is a band-aid, and typically not even a healthy band-aid.